Miss Adams, what were you suffering from when you came into our office for the first time?
A torn meniscus in my left knee.
And could you explain the type of pain, things that it was affecting in your life?
Right. I was in excruciating pain last October, and I had a cortisone shot. The pain went away, but I had very restricted mobility, and I could not do stairs. It affected my upper muscles in my thigh and my lower calf muscles. That's where the pain was in and the discomfort. I couldn't sit in a car without taking Advil, even for a short trip into town. It would be so painful when I would go to sit down. If I stood up after being at a restaurant, my knee I could hardly straighten it. It would be so stiff. And then I could walk it out and the pain would go away. But it seemed to be not so much in the knee, but in the calf and the muscles. I did physical therapy, and it seemed to, I was getting better, but when I came down to Florida for the winter, I noticed that my muscles were knotting up in my thigh and in my calf, and so I sought some help for that. I knew that I wasn't finished healing, and that my exercises seemed to be, that the physical therapist gave me, seemed to be counterproductive to healing.
Yeah, well, you reached a moot point in the traditional world as far as recouping the knee, but just like you're describing, which is very common in the realm that I live in with the chronic conditions world, that above and below the knee are greatly affected, and they're restricting how much healing, what level of healing you could take the knee to in and of itself. So, could you explain to people how long you've been under care and the type of results that you've seen so far?
Since the beginning of February, so I would say this is my 4th week.
So a month.
Yeah, I've been in a month, and it's been remarkable. I do up and down stairs. It was like, I have a little, it's not completely smooth, but my right knee isn't completely smooth because as I wasn't taking my left knee up and down stairs, my right knee didn't have a chance to practice stairs. So we're really relearning to do that because it's been about 4 or 5 months since I've done stairs. And I walk without any pain. And I've just noticed driving over to the car, I looked at the tennis ball I used to sit on to relieve a little bit of the pain, that I don't have to sit on it anymore. I don't have to take Advil when I get in the car. Whether I was a passenger or driver, it didn't matter. The pain was the same. Now I don't have it. And the Trigenics, I've only had 2 sessions with that, but it's yesterday or 2 days ago when I had my second treatment, it felt like air had been blown into my knee. I felt like I had a baby knee. I had the new knee again.
That makes me feel so nice. I love hearing this story.
Yeah, so I don't know how better to explain it. I don't think I'm there yet. There's still a little bit of swelling. I look forward to coming. I lie on a table and they fix my knee. Which is, I really feel that they're attacking all the problems. They're treating the swelling.
We're getting to the root cause,
right.
Not just the symptoms. We see symptomatic improvements by dealing with the root cause.
Exactly.
And
I particularly like that. Is it Hakumed or
the
what?
Hakumed?
Hakumed. That because I had that traditional at the physical therapy where they stim you.
Muscle stim is completely different than the Hakumed therapy.
Yes, I can feel that it's different. The very first time I had it, when I got up, for the next day, every time I took a step, it was like my brain had to relearn how to take that step. I was very conscious. It was a very unusual feeling. It was like, as you said,
we're re-educating the joint.
Re-educating the nerves to fire in a different way. And I don't feel that way anymore. Every time I get off of it, I don't feel that way. It was just that very first time. There was such a dramatic change from the way I had been walking that I realized that I was being retrained.
Can you, is there anything you'd like to share with anybody watching this video? Any message you'd like to send out?
Just that I'm one to seek alternative treatments. I don't believe that traditional medicine has all the answers, and was very hesitant about taking a chance because this was a pricey 2 months of therapy. However, I'm really glad I did because the most important thing is that my knee heals and I can go on with my life without fear of having pain every time I take a step, and that's very important to me.
That's important to me also, and I absolutely love this story that you just shared, and I feel so happy for you that you've experienced such remarkable results in such a short period of time.
Yes, and I will go through the end of March having these treatments, and I'm really looking forward to. I look forward to coming over here. I used to dread going to physical therapy. It was painful. It hurt. It was a lot of work. I had to do my exercises every day, which I did because I was determined to heal. But this is actually a painless procedure.
I love it. Thank you very much for sharing your story.
Yes.